Good day. I'm Dr. Jean Conry. I'm an obstetrician gynecologist, and I'm past president of the American College of Obstetricians and Gynecologists. I'm also chair of the Women's Preventive Services Initiative.
Hi, I'm Sue Kendig, a women's health nurse practitioner and director of policy for the National Association of Nurse Practitioners in Women's Health, and serve on the advisory panel for the Women's Preventive Services Initiative. We're both thrilled to be here with you today to talk with you about the Women's Preventive Services Initiative.
Next slide. First, we want to point out that this project is supported by the Health Resources and Services Administration of the United States Department of Health and Human Services, the Bright Futures for Women's Health Standard Practice Guidelines for Well Women Care. The information or content and conclusions are those of the author and should not be construed as the official position nor policy of, nor should any endorsements be inferred by HRSA, Health and Human Services, or the United States government. Next slide. I have no conflicts of interest to declare.
Nor do I.
Next slide. Now, I want to start by putting this in perspective with a patient I actually encountered, a 36-year-old obese woman with diabetes. When I saw her as an OBGYN, I had one set of recommendations I was giving her. And I want you to think about what kind of recommendations or what care this woman would receive if she says an OBGYN, an internist, a midwife, a nurse practitioner, a family physician. And then what if she's 18 years old? How much does that influence what each one of us is giving as advice or how we address this patient? Next slide. The Women's Preventive Services Initiative, as I said, is a federal grant supported by Health and Resources and Services Administration of the United States Department of Health and Human Services. Most importantly, it is a 5-year cooperative agreement between ACOG and HRSA's Maternal Child Health Bureau. It started in March 2016 and will go until February 2021. And there are two major purposes of WPSI. First, our goal is to develop and update recommendations for preventive health care for women across the entire lifespan. The second is to disseminate that information very broadly so that the recommendations are received by a wide array of providers, that whole list that I described early on, of women's health and to women themselves. Next slide. So why WPSI? Well, first of all, as you can imagine, there are gaps in preventive care for average risk women across their lifespan. There's an inconsistency in our guidelines, and we found that there's a lack of development, updating, and review of women's preventive services across their lifespan. WPSI will provide that niche. Next slide. But the important concept is coverage provided without cost sharing. Most private plans, large and small groups, individual plans, including the Affordable Care Act's Marketplace Plan, must provide the following preventive services without charging a copay or coinsurance. So if a recommendation is made by United States Preventive Services Task Force, an A or B recommendation, if it's an immunization issued by the Advisory Committee on Immunization Practices by the CDC, or if it's Women's Preventive Services Guidelines supported by HRSA, like WPSI is, those are provided without cost sharing. Now, there's a lot of variation, and you have to learn about that, as Sue will mention later on. Medicare covers the full cost of an annual wellness visit and preventive services that are rated by the U.S. Preventive Services Task Force. Next slide. To review our methodology, we select topics. These are topics that identify gaps in care, therefore the average risk woman, and we consider racial, ethnic, and underserved women in particular. We go through a systematic review with an advisory panel. We oversee the strategy. We go to an evidence-based practice committee, and then we go to our committee and get a review of that evidence and recommendations. We develop those recommendations. The steering committee creates those recommendations, and then we go out to external review for public comment. Our goal is to minimize the impact of bias by individuals and any conflict of interest. Next slide. there are two major components. One, we've got clinical recommendations, overarching summary recommendations based on the best available evidence and clinical expertise. Those are supported by HRSA. Non-grandfathered plans, as I said, are required to provide coverage without cost sharing. So the clinical recommendations are the focus of WPSI. Next slide. But we also make implementation considerations. We want to make sure that not only do we come up with recommendations, but all of our clinicians know how to implement them. So they address the clinical practice. They're not part of the HRSA guidelines, but they are part of WPSI statements. We put them in all of the information that we share. They provide clarity on practices, and they consider some of the information that may make it much easier to implement in a practice. We also include research recommendations because we know that there are gaps in service because of gaps in evidence. So we make recommendations on what we think research should take over. Next slide.
So now let's talk about the WPSI recommendations themselves. To date, WPSI has published 12 HRSA-approved recommendations. And among those recommendations are recommendations that are specific to maternal health. Things like breastfeeding services and supplies, screening for gestational diabetes mellitus, and screening for diabetes mellitus after pregnancy. There are also recommendations that are applicable to women across the lifespan, however, are important to maternal health as well. Things like contraception recommendations, screening for HIV and STI counseling, and our new recommendation, our newest, screening for anxiety, which actually is a companion to the U.S. Preventive Services Task Force recommendation for depression screening. And the anxiety and depression screenings are recommended for women across the lifespan, including pregnancy and postpartum. Next slide. So this is what the Well Woman chart looks like. And let's go through the Well Woman chart a little bit so that you can understand the components. Next slide. The Well Woman chart is a comprehensive tool that summarizes all of the preventive services recommendations for women from the Women's Preventive Services Initiative, the U.S. Preventive Services Task Force, as well as Bright Futures for those adolescent recommendations. And all of this is age stratified based on age, health status, and risk factors. When you look at the chart, you'll see a series of solid circles and open circles. The solid circles indicate recommendations from, again, the Women's Preventive Services Initiative, the U.S. Preventive Services Task Force, and Bright Futures. The open circles are recommendations for selected groups. Along with the recommendations, there are also clinical practice considerations, risk assessment methods, and age and frequency to deliver services that are described in the clinical summary tables accompanying the charts. And the chart is divided into topical categories. So general health, it covers infectious disease recommendations for women, cancer screenings, as well as pregnancy and postpartum recommendations. Next slide. And again, this is what you'll see on the Well Woman chart with the age stratification and the closed circles or the open circles, which indicate recommendations for selected groups. Next slide. And as you can see, the pregnancy and postpartum specific recommendations are broken out in the chart, so those are easily attainable for for maternity care providers. Next slide. Along with the Well Woman chart, each recommendation has clinical summary tables that give the rationale for the recommendation itself, as well as implementation considerations, practice considerations, references, and the research recommendations that we talked about earlier. Next slide. WPSI also has a variety of supporting materials. There are frequently asked questions that generally respond to questions around the Well Woman chart itself, and newly released is an FAQ around telehealth services. Many times we think about preventive services as being something the woman has to be physically present for. However, many of them, like screening for depression and anxiety, screening for intimate partner violence, STI counseling, and so forth, can actually be done during a telehealth visit. So this provides information that may be helpful to clinicians as we move between telehealth and in-person visits. Next slide. Also newly released is our coding guide, because clinicians told us there might be confusion around billing for preventive services. So we heard you and issued coding guidance for all of the WPSI recommendations. There's also information about Medicare and Medicaid, which is really important to understand because there are subtleties in terms of what's covered and what women can access if they have Medicare or Medicaid, and that's particularly important to understand the differences in coverage between Medicaid expansion states and not Medicaid expansion states. Next slide. There's also a patient trifold that you can either order hard copies of or download online to have available in your office for patients. Next slide. Importantly, we really want clinicians and women to be involved with WPSI. Download the applications and the recommendations. I've gifted my personal healthcare providers with copies of the Well Woman chart. It's really good to have this in patient hands. You can request hard copies of the WPSI materials. You can download them for free from our site. Importantly, participate in the public comments. Everything is open for public comment. So whenever we issue a recommendation, we want to hear from you. Likewise, if there is a gap in service, we want to hear about that too, so it can be considered as a potential for going through the recommendation process. Join our listserv so that you can take advantage of hearing about what's coming from WPSI and can be part of that conversation. Next slide. And if you have any questions or have any difficulties in downloading any of the materials, please contact our wonderful WPSI staff. They are extremely responsive and are there to get the word out. Next slide. Thank you so much for inviting us to present on behalf of WPSI today. Again, we're thrilled to be here with you and hope that you'll find this information helpful in your practice and in your life as a healthcare consumer. Dr. Conry, any last thoughts?
Also, Sue, it's always nice to present WPSI with you, and asking everybody to contribute is really one of the most important steps for us. Having you share this information will get the word out to everybody. Thank you.